I want to read all three of your comments because I think a lot of people could relate to this. You said, I left my child's neurologist when he did Tele-Health and humiliated my child by making her do all this weird evaluation on the floor. I got so mad and said, how long are you going to do this over computer? He said, indefinitely. I said, well, goodbye, you lost a patient. Doing examinations over an iPad is so unacceptable, so humiliating, even for a child. I absolutely agree. I was somewhat shocked when they brought telehealth, as I said in my other video, into psych. You know, one of the most respectful things humans can do for other humans is to pay them the respect they deserve by being present, especially in their worst moments. And really that's kind of the role of a mental health nurse is it is to be human. And yet all of the people from nursing associations, medical associations, to hospital associations and CEOs, and then all their cronies that go along with their ridiculous ideas, have been chipping away at the human part of nursing. And yet everybody just goes along with it because, what can you do? You don't have any power over the CEOs. Here's what my hope is, though, because we don't really know. I don't know where Trump stands on AI, but I don't think for one moment he supports the amount of AI and the surveillance and all this stuff that we're under. Not at all. I think that there were people in Trump's administration who were loyal, but they were the faces you didn't see. The people you just don't really know. Not everybody surrounding him was. I think that most of the people that were loyal, that went in with him, I think they knew they knew most of the hospital systems were corrupt. They knew all of these created associations were standing in the way of the American dream, because there's no way when you have this layer and layer and layer of associations, it's like they all block you from being able to live under your Constitution that was created for, you and I, that we're supposed to be the boss of. And I think ultimately that's what scares most of them, because those associations are really just wings of the government, because they have the lobbyists. And so even though they're not like the associations aren't tied under the government, they operate as an administrative arm for them, which is that fourth branch of government, as I recently talked about. It's that administrative evil. And that's what we see right now. Bringing telehealth to psych was the most depersonalizing thing ever, because we could at least pay patients the respect they deserve when we are trying to understand what's going on with them and they're in their most vulnerable state. The least we could do is be present in the room. Yet over time, this is what these degenerates have done, is they have taken every bit of humanity away. And so that's the reason why I brought up the evil component to this so much, because everything they support and are just doing, they don't care what anybody else thinks. And that's what really, it's everything they're supporting is very sociopathic. Like, it just is. They're the Hippocratic AI, the telehealth. They always wrap it around that this is good, this is going to help you. No, it only ever helps them. So I think that's why these people are petrified of Trump. But I don't think they were petrified enough. And they maybe still aren't, because they figure the Democrat Party is going to find a way to pull off whatever they have to in 2024. Because I think that a lot of these things will be eliminated. It's as simple as this. If Trump gets back in, he tells every hospital, all these 40 healthcare agencies that got on board with Hippocratic AI, that you're not going to get any Medicare funding until you eliminate it. You'd think that those CEOs would be thinking about that right about now. The election is right around the corner, really. But I think that they're maybe just their ego is too big. I mean, it's been too big for a long time. Um, and they just figured, oh no, he won't get in. We'll do whatever we have to. Yeah, I think they're making a big mistake there. But I think they made a big mistake long ago, because most of them throughout the years, whether it's the CEOs or the chief financial officers or somebody, usually in the over and over again, throughout history with healthcare, there's been all this skimming off the top, and people just, at that level that are doing not only unethical things, but they're thieves. That's the reason they never have any money, is they just continually pocket it all. It's why I say they're very sick with money. It's wicked. And then what that does is it makes them think that somehow AI is going to bring humanity, or bring humans back into healthcare. It's like, no, to bring humans back into healthcare to where it's caring, we have to stop letting sociopaths run it. Yeah, I've known that for years. It just keeps going downhill. It becomes more dehumanizing, more degrading. When psych patients come in, they're usually at their lowest point of feeling degraded and dehumanized for whatever reason, whether they hate themselves or something happened in their life, some crisis, trauma, whatever. And then to come into the healthcare system to get help and to be more dehumanized because nobody even has enough respect for you to meet you face to face, and all because of a bunch of dirtbag medical nursing associations and hospital associations and CEOs who have been destroying humanity in healthcare in every way they can. So, yeah, when I read what you wrote, it made me think about the dad that had the little boy. I don't know if you had heard about this story, but it was like less than a year ago. He had a Tele-Health visit for his son because his son had a rash. So he had this Tele-Health visit with the pediatrician. And so after they had talked about, different symptoms, all this, the doctor on the Tele-Health said, or the pediatrician said, I need to see the rash. So in order for the dad to show him the child's rash, there was no way of showing it without showing the groin, because it was like near the groin. And then I think it was in less than a week, or even less than 72 hours, some internet police or FBI, I can't remember which, showed up, were trying to say that, or contacted him and locked him out of a bunch of things online because they said he was pushing child pornography. It was a Tele-Health visit. So then you wonder, how secure are these visits? Because I don't believe what these people say in healthcare anymore. I just don't. The CEOs have been lying for a long time. That's why they move them in and out at many places, the big places. That, as I've said, that's what they do. But they, no matter how much they say something is safe, I don't. Yeah, when you have, that father went into that doctor's appointment, the Tele-Health visit, thinking, yeah, this is secure. The doctor's doing it, and obviously it's okay. And then comes to find out, well, somebody thought he was pushing his child, his pornography, and he wasn't. I think he was even on Glenn Beck, and he talked about it. I think he got it worked out, but can you imagine? It's like, yeah, as much as it's a pain in the office, or pain in the ass to go to the office sometimes and see the doctor, if it's something like that, the computer is just, there's never any total secure thing in the computer. So, and just one more thing that people should know is that I've said before that every healthcare system, every hospital is on the same charting program system. It's called Epic. Do you want to know who suggested that and wanted that put in, especially after Obamacare? Hillary Clinton.